Before 1846, surgery was done on people who were fully awake. Most people know that in the abstract. What they don't know is the strange thing it did to the profession. The best surgeons of that era were not the most careful ones. They were the fastest ones, and they were famous for it the way athletes are famous, by the clock. There was a London surgeon named Robert Liston who could amputate a leg in under 30 seconds. People came to watch. Speed was the whole game, and there was a genuine mercy in it. Every second a conscious patient spent under the knife was a second of pain no drug could touch, so the faster you were, the less you made them suffer. Liston was the fastest, and it made him a star. It also, in one famous operation, reportedly killed 3 people at once. To understand how a single amputation kills 3 people, you have to understand what surgery actually was before we could switch a patient off. Picture the room. The patient is awake and about to feel everything. So the patient has to be held down, physically restrained by assistants, leaning their weight on a person who is about to fight with everything they have, because the alternative is the patient thrashing into the middle of the operation. The surgeon has to cut through that. Fast, decisive, through the screaming and the struggling. Precision is not the priority in that room. Getting it over with is the priority. The entire craft was shaped, top to bottom, around one constraint. The patient is awake, so hurry. Now, the Liston story. In one operation, moving at his famous speed, he's said to have amputated the leg so quickly that he also took off 2 fingers of his assistant and slashed through the coat of a spectator standing too close. The assistant later died of infection in an era before we understood infection. The patient died too, of the same thing. And the spectator, whose coat was cut, reportedly dropped dead on the spot from shock, convinced he'd been fatally stabbed. 3 dead, 1 operation. It gets told as a dark joke. The fastest surgeon in London, so fast he killed the audience. And most people stop right there at the punchline. But the punchline is backwards, and the real point is the reverse of the joke. That story isn't remembered because Liston was uniquely reckless. It's remembered because the incentives of pre-anesthesia surgery rewarded exactly the behavior that caused it. When speed is survival, care becomes a luxury nobody can afford. The recklessness wasn't a personal failing. It was the logical output of the constraint every surgeon in the world was working under. Put anyone in that room, tell them the patient feels every second, and they will optimize for speed too. And that is what actually changed in 1846, when ether was first used successfully for surgery. We remember anesthesia as the thing that ended pain, and it did. But its quieter, larger effect was this. It removed the reason to hurry. For the first time in the history of medicine, a surgeon could be slow, could stop halfway through and think, could take the extra minutes to do a thing carefully instead of fast, could try an operation too delicate to ever attempt on a person who was awake and struggling. Look at what followed. Nearly every advance in surgery that we consider simply normal became possible only once the patient stopped screaming. The anesthesia came first, the precision came after, not the other way around. The surgeons didn't suddenly acquire new hands in 1846. They were finally allowed to use the hands they already had. So the brutality of old surgery wasn't really a story about cruel or clumsy surgeons. It was a story about a constraint so total that everyone mistook it for the nature of the work itself. Remove the constraint, and the skill that had been trapped underneath it the whole time finally had room to show up. That's the part worth carrying out of the history. Sometimes the thing holding an entire field back isn't a shortage of talent. It's a single limitation everyone has quietly accepted as permanent, as just how things are. And the person who removes that limitation changes more than they meant to. Ether was sold as an end to pain. What it actually delivered was the beginning of careful surgery. The pain was only the thing everyone was looking at. See you in the next case.